Hello, health-conscious viewers and medical tech enthusiasts. Welcome back to Life of Medical. I'm your host, and tonight, we're focusing on a life-enhancing and often life-sustaining piece of medical equipment that provides the very breath of life for many, the oxygen concentrator. Our episode is titled, Breathe Easier, Your Ultimate Guide to the Oxygen Concentrator, How It Works and Who It Helps. Whether you or a loved one relies on oxygen therapy, or you're simply curious about this vital technology, we've got you covered. Let's take a deep breath and dive in. What is an oxygen concentrator, and how does it differ from an oxygen tank? First things first, what exactly is an oxygen concentrator, and how does it differ from the more traditional oxygen tank? An oxygen concentrator is a medical device that filters ambient air from the room to deliver a continuous supply of concentrated oxygen to a patient. Unlike an oxygen tank, which stores a finite amount of compressed or liquid oxygen and needs to be refilled or replaced, an oxygen concentrator produces its own oxygen on demand. It essentially takes the air around you, which is about 78% nitrogen and 21% oxygen with small amounts of other gases, and separates the oxygen from the nitrogen, delivering air that is typically 90 to 95% pure oxygen. This means as long as the device has power and the room has air, it can provide a virtually endless supply of medical-grade oxygen, offering greater convenience and independence compared to tanks, especially for long-term users. How does an oxygen concentrator work to produce medical-grade oxygen? Now for the really clever part. How does an oxygen concentrator actually work its magic to extract and concentrate oxygen from room air? The most common technology used is called Pressure Swing Adsorption, PSA. Inside the concentrator, there are two cylindrical columns or sieve beds filled with a crystalline material called zeolite. Room air is drawn into the machine by a compressor and passed under pressure into one of the sieve beds. Zeolite has the unique property of selectively adsorbing nitrogen from the air while allowing oxygen and other gases to pass through. As the nitrogen is trapped, the oxygen-rich gas exits the sieve bed and is collected in a reservoir. Just before the first sieve bed becomes saturated with nitrogen, the airflow is automatically switched to the second sieve bed. While the second bed is busy absorbing nitrogen, the first bed depressurizes, releasing the trapped nitrogen back into the room air. This cycle rapidly repeats, ensuring a continuous flow of concentrated oxygen to the patient. Where are oxygen concentrators primarily used? So, where are these ingenious oxygen concentrators primarily used? Their most significant application is in home oxygen therapy. For patients with chronic respiratory conditions who require long-term oxygen supplementation, home oxygen concentrators provide a reliable and convenient source of oxygen in the comfort of their own residences. These stationary units are typically designed to be robust and provide a continuous flow of oxygen. In addition to home units, the development of portable oxygen concentrators, POCs, has revolutionized oxygen therapy for active individuals. These smaller, lightweight, battery-powered devices allow patients to maintain their mobility and independence, enabling them to travel, attend social events, and carry on with daily activities outside the home. You'll also find oxygen concentrators in some smaller clinics or healthcare facilities, particularly in areas where regular delivery of oxygen tanks might be challenging or costly. When is an oxygen concentrator prescribed by a doctor? The crucial question is, when is an oxygen concentrator typically prescribed by a doctor? A physician will prescribe supplemental oxygen, and thus an oxygen concentrator may be recommended when a patient has a medical condition that causes their blood oxygen levels to be consistently too low, a condition known as hypoxemia. This is usually determined through blood tests like an arterial blood gas, ABG, study, or pulse oximetry. Common conditions that often necessitate oxygen therapy include chronic obstructive pulmonary disease, COPD, which encompasses chronic bronchitis and emphysema, severe asthma, cystic fibrosis, pulmonary fibrosis, sleep apnea, and late-stage heart failure. Sometimes, oxygen therapy is prescribed for short-term use, for example, during recovery from certain surgeries or for acute respiratory illnesses like severe pneumonia or, as we've seen in recent times, for some COVID-19 patients. The goal is always to maintain adequate oxygen saturation in the blood to support organ function and improve quality of life. Why are oxygen concentrators a preferred choice for long-term oxygen therapy for many patients? This leads us to why oxygen concentrators are often the preferred choice for long-term oxygen therapy for many patients compared to traditional oxygen tanks. Several key advantages make them highly suitable. Firstly, convenience and continuous supply. As long as there's a power source, an oxygen concentrator can produce oxygen, eliminating the need for frequent tank deliveries, storage of multiple heavy cylinders, and the anxiety of running out of oxygen. Secondly, cost-effectiveness. For long-term users, the overall cost of running an oxygen concentrator can be lower than the cumulative cost of renting and refilling oxygen tanks. Thirdly, safety. Oxygen concentrators don't store large volumes of compressed oxygen, which can reduce some of the risks associated with high-pressure cylinders. For portable oxygen concentrators, the enhanced mobility and freedom they offer significantly improve a patient's quality of life, allowing them to remain active and independent without being tethered to a stationary system or having to manage bulky tanks. Who typically benefits from using an oxygen concentrator? So, who are the individuals who typically benefit most from using an oxygen concentrator? The primary beneficiaries are patients diagnosed with chronic respiratory diseases that impair their ability to get enough oxygen from breathing room air alone. As mentioned, this prominently includes individuals with COPD, which is one of the leading reasons for prescribing long-term oxygen therapy. Patients with pulmonary fibrosis, a condition that causes scarring of the lung tissue, often require supplemental oxygen as the disease progresses. Those with severe, persistent asthma or cystic fibrosis may also benefit. People suffering from advanced heart failure, where the heart cannot pump blood effectively leading to poor oxygenation, can find relief and improved function with oxygen therapy. Additionally, individuals with conditions like severe sleep apnea that lead to nocturnal hypoxemia, low oxygen levels during sleep, might use an oxygen concentrator, sometimes in conjunction with a CPAP machine. Ultimately, anyone whose doctor determines they have chronic hypoxemia can benefit. Key features to look for in an oxygen concentrator. If you or a loved one is considering an oxygen concentrator, it's important to understand some key features to look for in an oxygen concentrator. For home units, consider the maximum oxygen flow rate, measured in liters per minute or LPM, to ensure it meets your prescription, the oxygen concentration level, typically 90 to 95%, noise level. Quieter models are preferred for home use and energy consumption. For portable oxygen concentrators, POCs, crucial factors include weight and size for ease of carrying, battery life, and recharging options, including car chargers, the type of oxygen delivery, pulse dose versus continuous flow. Continuous flow POCs are generally larger and FAA approval if air travel is anticipated. Other important features for both types include user-friendly controls, clear display screens, audible alarms for power failure or low oxygen concentration, and durability. Always consult with your healthcare provider and a reputable medical equipment supplier to choose the model that best fits your medical needs and lifestyle. Maintenance and care for your oxygen concentrator. To ensure your device functions optimally and safely, proper maintenance and care for your oxygen concentrator are essential. Regular maintenance is usually quite straightforward. The exterior of the unit should be kept clean by wiping it down with a damp cloth. Most importantly, the air inlet filter needs regular attention. This filter prevents dust and particulate matter from entering the machine. It usually needs to be cleaned weekly, by washing with mild soap and water and air drying thoroughly, or replaced according to the manufacturer's instructions. Some units may also have internal filters that need periodic replacement by a qualified technician. It's also vital to keep the area around the concentrator clear of obstructions to ensure proper air intake and to prevent overheating. Regularly inspect your oxygen tubing and nasal cannula or mask for any cracks or damage and replace them as recommended by your supplier. Always follow the specific maintenance schedule outlined in your device's user manual. Safety tips for using an oxygen concentrator at home. Safety is paramount when using any medical device, and this is especially true for safety tips for using an oxygen concentrator at home. Since oxygen supports combustion, it makes fires burn hotter and faster. The most critical rule is no smoking and no open flames near the oxygen concentrator or where oxygen is being used. This includes cigarettes, candles, gas stoves, and fireplaces. Keep the concentrator at least 5 to 10 feet away from such sources. Avoid using flammable materials like oil-based lotions or petroleum jelly on your face or upper chest when using oxygen. Water-based products are safer. Ensure the concentrator is placed on a hard, stable surface in a well-ventilated area, away from curtains or anything that could block air vents. Do not cover the unit when it's operating. Have working smoke detectors in your home. Familiarize yourself with the device's alarms and what they mean. And always have a backup plan in case of a power outage, which might include a backup oxygen tank if prescribed by your doctor. Portable versus home oxygen concentrators. Which is right for you? Finally, let's consider portable versus home oxygen concentrators. Which is right for you? The choice largely depends on your medical needs, lifestyle, and doctor's prescription. Home oxygen concentrators are larger, stationary units designed for continuous use within the home. They typically offer higher continuous flow rates, up to 5 or 10 LPM, or even more for some models, and are generally more robust for around-the-clock operation. They plug into a standard electrical outlet. Portable oxygen concentrators, POCs, are designed for mobility. They are much smaller, lighter, and run on rechargeable batteries, allowing users to be active outside the home. Most POCs provide pulse-dose oxygen, delivering a burst of oxygen when you inhale, which is more efficient for battery life. Some larger POCs can also offer continuous flow, but they tend to be heavier and have shorter battery lives. Many patients who require continuous oxygen use a home unit while at home and a POC when they go out. Your doctor will determine the appropriate type and flow rate based on your specific oxygen requirements. And that's a comprehensive overview of the incredible oxygen concentrator, a device that truly empowers individuals to breathe easier and live fuller lives. I hope this session has been informative and helpful. If you found value in this video, please give it a thumbs up, subscribe to Life of Medical, and hit that notification bell for more insights into medical technology. Stay safe, breathe well, and we'll see you in the next video.